cancers, abnormal growth of cells found at the level of the lungs. The causes are quite ambiguous, but it's important to know that 90% about that of lung cancers are linked to smoking. So tobacco is like one of the most causes of cancers. And like we said, you have the active and the passive, both of which lead to lung cancers. Because if you take people who are exposed to passive smoke and compare them to people who are not exposed to smoke, their risk, their incidence of lung cancers is higher. It's higher in those who are exposed to passive smoke than those who are not. And then we also have the familial predisposition. So if you have a family relative who has had a lung cancer before, you are more exposed to having a lung cancer. Equally, prior history of lung cancers. If you have had a lung cancer before, your risk of having another one is higher than another person. And like we said, air pollution is also a factor for risk cancers, for lung cancer, sorry. Now, prevention of cancers, from what we said, is mostly linked with smoking. So cessation of smoking, avoidance of passive smoke, and then we also have early detection. It's not so common around us, unfortunately, because before you hear about a CT scan in Cameroon, you need to get to Douala or to Yaoundé, at least for the moment. And that's the most sensitive way of detecting lung cancers, because sometimes you do a chest x-ray in a patient who is presenting chest symptoms and you will not find a mass there to make you suspect a lung cancer. But at the same time, if you do a CT scan, you will find a clear indication of a cancer. At that stage, treatment is better. But we need a lot of work in our system to improve on our means of diagnosing. And also, we need to remember that there are small cell cancers in the lungs, and then we have non-small cell cancers too. Now, the extent to which the cancer cells have spread will make us stage the cancer. And depending on the stage now, the treatment will be elaborated. Is it surgery? Is it surgery and chemotherapy? Is it surgery and is it surgery and radiotherapy, or is it just chemotherapy or radiotherapy?
Can I just please, when we talk about smoking, drinking, those are addictions. And the way all of us have observed with those of our family members or friends, or even some of us who are involved with those addictions, is that the addictions come gradually. They begin like play. For example, if you get into, when a child becomes about 12, 13, 14, especially boys, they easily get used to cigarettes just to show off. Gradually it becomes a habit. You can no more leave it. So when the way you will, as an educator, the way you handle these situations in your families, with your friends, your students, is very important. Always telling him smoking is bad. He knows it. Drinking 5 bottles of beer every day is bad. They know it. But what is the problem? It is that habits, addictions take longer to break than the time they take to get adopted. So please use real techniques to bring this person to, first of all, realize the importance of staying cancer-free. Not by frightening him or her, but by educating and really talking to the person and gaining that person's confidence. So thanks very much for that. That's okay.
Okay, that was the big one for lung cancers. And the last one we'll tackle is the prostate cancers. Lest we forget men, even though lungs concern more men too, because men smoke more. What's the prostate? There's so many men here. Do we know the prostate? The prostate? Surrounded.
The prostate is around your testis and your penis.
You said the prostate is around the testis and the penis. Can you see your prostate? So where is the prostate?
prostate is it's a fat under your testes. With inside, it's invisible. So it helps in finally it's a fat tube.
It's part of the reproductive system and it surrounds the urethra. If you know the transition of urine from the kidney, it comes down through the ureters, it gets into the bladder, and then there is another small pipe down there, they call it the urethra. That's what connects with your penis, that's why you pass out urine out there. So the prostate surrounds part of the urethra. It's right inside, you cannot see it. Sometimes, even when you examine it, we usually do what we call a rectal exam in the hospital to examine the prostate. But the normal prostate is not even filled. So, or when you feel it on examination, normally it's supposed to have a rubbery consistency with some line at the middle, but it's a very small gland. It's like the size of a 25 franc coin. That's how small the prostate is. Okay, so prostate cancers are more common in men and men after a certain age. So when men get to about 38 years of age, we usually advise them to screen for prostate cancers regularly. And the most common test that we use to screen around here is a rectal exam. Like I said, when you go to the hospital, the doctor sends a finger into your anus to try to evaluate it. That's a rectal exam. And then we also advise you to do what we call the PSA. The PSA is produced by the prostate, and so when the amount is increased in your blood, we have an indication that you might be having a problem with your prostate. Now, a problem with the prostate could be a cancer, but there's also a swelling of the prostate which comes with age and which is not necessarily a cancer. We call it the benign prostate hypertrophy. So the prostate is just increased in size. We say it is hypertrophied, but it's not a cancer. We could also have prostatitis, which is an inflammation of the prostate, which can be caused by an infection and is not a cancer. And those two conditions don't necessarily predispose to cancers. But after 38 years of age, screen yourself regularly to be sure that you don't get a cancer. Cancer of the prostate can spread or metastasize to other parts of the body, especially the bones. Those who have prostate cancers usually have metastasis to their bones, so they have fractures more commonly. Yes, and in an advanced age, you need to check the prostate. And then you also have the lymph nodes. Those are the two most common locations where cancer of the prostate will spread to. Now, when you have prostate cancer, you might not have any symptoms to make you suspect. But there are other symptoms that if you have, and at a certain age, it's good to go and check your PSA to be sure that it's not a cancer. If you have difficulties in urination of any kind, it could be that you find it difficult to start urinating. Somebody who goes to urinate, but it takes so much time for the urine to come out, even though he has the urge. It's one of the symptoms. Somebody who has urinary urgency, when he feels like urinating, he needs to urinate there and then. If not, the urine will come out unawares. It's a sign of prostate cancer. Somebody who has what they call terminal dribbling. When you urinate, some drops fall at the end. You feel that you have finished urinating, but some drops keep on coming. It's another symptom. Somebody who has poor erection. Somebody asked a question about the testes and the prostate. I cannot remember so well, but prostate cancers can cause poor erection. And then if you have painful urination and mixture frequency, that you urinate too often, you urinate now in very small quantities. Before you sit down a little again, you feel like urinating. We call it frequent urination. It's a sign of prostate cancer. Then you can also have semen that comes with blood in it. It can equally be a sign of prostate cancer. And so when you have that, it's good to consult the hospital. They'll do you a rectal exam. They'll send you for a PSA, which will tell whether you have one of the two conditions I cited, which are non-cancer. So the benign prostate hypertrophy or prostatitis or a cancer. If it's one of the other two, fine. But if it's a cancer and it's noticed early, like we said for all the other cancer, you have an added advantage. So cancer is deadly, but the good thing about cancers is that if you are aware of the causes, the risk factors, and you prevent you take the necessary measures for prevention. You follow screening very carefully, especially when you know you are at risk, and you do that constantly. You can keep yourself away from cancer, or if you were to have a cancer, which we don't pray for, you will notice it early enough, and medicine will be able to help you more. Thank you so much for your attention, and if there are any other questions, we'll take them.
Families, and you have just said that it can be prevented. If my mother died of cancer, how can I prevent? Or if there have been, say, 2 or more deaths in a family of cancer, how can those who have not yet had the symptoms or the disease prevent it?
Okay. Now, since causes of diseases in medicine, we usually divide them into those that can be altered and those that cannot be altered. So the family history cannot be altered. If you have a family history of cancer, you have it. There's no way that we'll be able to go back down the family line and wipe it. But if you have a family history for cancer, it's supposed to just create a high awareness at the level of the family, get the family to be alert, and then you just play with the factors that can be manipulated. Yes, so like the smoking, like the drinking, like the good eating habits, and most of all, make sure that you get screened more often than the others. I think that's what I get. What kind of cancer? Okay, mostly cancers of the cervix, because the risk factors for cancer of the cervix and HIV, they are related. So, cancer of the cervix is more common in HIV-infected patients, particularly.
Yes, please.
Doc, you gave the symptoms of the prostate cancer, but you didn't give the main causes of that prostate cancer.
The main causes of the cancer, there is no particular cause to it. It's just said that it is more common in black men. Yes, I'm sorry I didn't mention that. It's more common in black men. No. It's contradictory, but in sexually active men, no. Literature denies that. Yes, and after a certain age. So they talk more of the racial factors, the age factor. Then you have smoking, which can also, but as per causes of cancers, really, literature still has, medicine still has a lot to do about it.
Please, Doc, why black men?
Maybe we ask God when there are some things that cannot explain.
Then, doctor, at what age can you start, because these symptoms, even at the age of 17, there are people with these symptoms that you have given.
Yes.
At what age that you can start at least think about or suspecting that this can lead you to prostate cancer?
38 years.
38 years.
Yes. Before that, usually the symptoms are linked to urinary tract infections. But after 38, from 38 and above, cancers form a strong cause of this.
Make somebody that is smoking not to have a desire to smoke.
Good. Let me give you, please. You're asking the question to the right person because I have gone through that experience. The truth about it is that it is a personal decision. As you started, that's how you will go back there. Try to take those steps that today I will not smoke because there is no drug that they can give you. There are drugs that tell you that okay, they will reduce the possibility for you not to smoke. They call them patches. You go to a pharmacy, especially in Buea and Yaoundé, you buy them, they are very expensive. You place them on a vein for the whole day. When they substitute nicotine. But at the end of the day, you see people who have used patches for 6 months, even 8 months, still smoking. But there are people who don't use anything. The guy just gets up in the morning and says, no, enough is enough. And please, those of you who are or who have family members who are smokers, your husband or your wife or your child, please, or your father, because the problem is mostly with fathers and husbands. They just sit in the living room and smoke. Everybody passes by. Please try to talk with them that he is responsible for his life. He should not endanger all of you. Let him.
Yeah, a lot of things have been happening. Of breast cancer. Okay, let me just brush over the others that we talked about, like your smoking, like your family predisposition, like late deliveries, like no kids. Those are all causes.
I just want to say that with our African mentality, we know that one of the symptoms of prostrate is difficulty in having an erection. Let's say a man who is polygamous and is having these difficulties in erection. How will the wives manage it? I don't know. Even a single woman. Because I'm sure it's going to cause a lot of problems.
To encourage him to find the cause of that difficult erection. Yes, because having a difficult erection could be a sign of prostate cancer, but it's not always the case. Problems can do it. Psychology is very important. Diabetes is a cause. Hypertension is a cause. Some drugs which include treatment for diabetes and hypertension can cause it.
But this
stress
will come and go,
can
but
cause
the prostrate will continue.
it. It will be treated. Like I said, it's to encourage you to find the cause. Because if eventually it's the prostate cancer and it's managed early, he can regain his sexual function. So don't let him stay like that and go down the drain. Encourage him to go to the hospital, find the cause and the solution.
Just to add something more, those problems, we know fully well that a man is not just the physical and the spiritual, it's the psychological. Let us always strive as much as possible in everything we do with our fellow human beings to encourage, motivate, and praise them. We should do that. Even if the guy is not, if he's a polygamist and you are one of the wives and you don't like it, you're already there. And talking to him, counseling him, motivating him is another factor that can do miracles.
Women should thank their husbands after the activity.
Always do that.
Mom has just said something here that is very important. Please, suspicion is a key factor it's key to the destruction of marriages or relationships. You just sit and imagine something with no proof. And that is born out of a little bit of idleness. If you are busy all the time doing something, reading this, doing that, you will not have much time to be thinking that since Pa is out of the house, he is with Mary and X or Y. So please, let's try to also start trusting each other. Let's try to also start thanking each other and motivating each other.
Excuse me, Pa will go out in the morning, stay wherever he is. He comes back in the evening, Mommy has cooked food and kept. He eats, he bathes, then he sleeps and turns his back. Mommy will be obliged to be suspicious.
Please, can I find out one of the fathers here? Can one of the fathers help us out with? Okay. So please, we are very, very happy that we are already at this level. Doctor, you have one more question.
I have heard that there is another kind of cancer that is killing children within the age of 1 to 15 years old as kids. I don't know how far that is true.
Yes, it's one of the most common cancers in children, Burkitt's lymphoma. Is that what you said, Burkitt's? Okay, Burkitt's lymphoma. There are cancers that are precise to children. You have lymphomas, which can be Hodgkin or non-Hodgkin. Burkitt's is just one of those lymphomas. And it presents in a particular way. Do we know mumps? Yes. Okay, mumps causes the jaws to swell. Burkitt's will cause the jaw to swell. And that's the reason why sometimes when these children have these lymphomas, we keep on treating them for mumps. But the difference is that mumps is a viral disease, and within 1 week maximum, it should regress even if you are not treated. So if a child has a swelling of the jaw, and especially if there are lymph nodes too, if you look here, there are some small swellings around the neck. They can also be around the armpits. They can be around here, the inguinal folds. If a child has that kind of problem and you take to the hospital, they are treating for mumps, it's not responding, you need to take it higher because it might be a Burkitt's lymphoma.
But doctor, what's the connection between mumps and the penis? Because there says it is believed that when for males, mumps destroys the productive.
Yes. The virus that causes mumps can also attack the testes and cause what they call mumps orchitis. So in some young boys, they will not only have the mumps, but they will also have that orchitis. So that's the connection. The virus can touch you.
Please, mommy principal. Okay,
I'm just saying that we have heard these lectures and we are so satisfied with it. How are we going to get our mothers there in the village to know about this all what the important things they have told us?
That's why we started with you people, Mama, because we know that while waiting for when we will be able to get to those mamas down there, you meet them now. So if you meet them now, you can try to just create the awareness. But we are hoping that with time we'll be able to access other places.
Okay, Mom, you are just bringing in what I wanted to discuss, to tell you at the end of this. This is not, as we told the principal yesterday, this is not just a come and go and forget kind of relationship. We are creating, the project is called Cancer One College. Cancer One College is bringing together professionals, cancer professionals, health professionals, educators, civil leaders, and the common man. We sit together and we learn. I have never gone, I'm not a medical doctor, I'm a language teacher. I've never gone to school, but at least what I know from medical experts has enabled me to be able to get involved in this. Please, that coming up with strategies that will enable this talk that we have here to go far and wide. The next month, on the 4th of February, will be World Cancer Day. If you look at the way other diseases are being treated in this country, you will discover that World Cancer Day might pass without anybody coming here. But World AIDS Day, people are here. And we know that when you look at AIDS, malaria, all these other, they can be detected early enough and treated. You can avoid them, you can prevent them. But with cancer, it's a little bit more complicated. And the notion was that cancer, before now, was a rich man's disease. It affects everybody in our families. And most of them begin by going to traditional doctors instead of going straight to the hospital. And they waste time there. At the end of the day, we find this kind of situation where it cannot be cured. So please, with the Cancer One College project, we will begin with talking. Later on, we'll come back with activities that will enable the school and the community to be vibrant. We appeal to you that if you have listened to our talk, and it's good, we have a website. It's on the brochures, www.celeBritys4africA.org. Go there, there is enough information on that website. We will organize. We need volunteers. All of us here, please, are volunteers. We come, we spend part of some of our money to rush around and do things because we know that it's something noble. And what we need is you as volunteers, go to your houses, first of all, start volunteering there. Distribute, show them this one, let them read. After that, we will also be having activities that will engage, that's real physical activities to make sure that we show how cancer is being fought. One day, with the means, if the means are available, we'll do scanning. We arrange for a machine to be placed at the hospital. We can rent it. The machine to be placed at the hospital, and we take 1 week or 1 month for free scanning in Kako division. So those are some of the things that we are doing to come towards this, to create that awareness so that cancer should be prevented and not treated. So we thank you very much, and a special thank you goes to the principal and staff for offering us this opportunity. And we just pray that the message has gone through and that we promise to come back with more interesting things and talks. So, thanks very much. Have a nice day.
On behalf of the entire staff and students, we also want to thank you for coming. And we want to propose that when we are planning to have our seminar, we also want to invite you because some of the students and teachers are not here. Most of the staff members who are here were to have classes this morning. So they were fortunate to meet us, having this discussion. We want to say that the presentations have been very, very enriching. And we do hope that some of the students will not misinterpret what they have said. I also want to propose that if there are any questions, after having read the brochures, you can write them down and we can always invite them or contact them, to come and give us some explanations. We want to thank you for coming and for choosing our institution. We do hope that the knowledge we have acquired will help us improve a lot on our health. So thank you once more for coming, and may the Lord Almighty take you back safely, and Happy New Year.
And we just have a good picture, all of us. Please. Okay, please just turn around. Wow. Just come now. Somewhere there. Doctor, we are waiting for. No smiles. Let me say it now, man. As smiles are getting in. Is it okay? Okay. Come this way, sir. That's okay.